Hello and shalom to all. Technion alumni, American Technion Society friends, guests from the American Friends of Sheba Hospital, including Executive Director Eric Heffler, and Technion friends from around the world. Thank you all for joining us. My name is Anat Feinberg, and I'm the National Director of Alumni Relations at the American Technion Society. The Technion Alumni Relations in the US is a joint initiative undertaken by the Technion Alumni Association based in Israel at the Technion campus in Haifa and the American Technion Society based in the US and working for the past 80 years to provide support to the Technion. The Technion Alumni Initiative is focused on building the alumni community around the country as part of a global network. Technion alumni in Israel and around the world are leading force in technology, research, and science. The celebration of Yom HaAtzmaut last week reminded us of the vital role of the Technion and its alumni. Technion engineers were the driving force of building our country in its earliest days and are the most notable leaders today, driving Israel high-tech technology, innovation, research, and science, including these days fighting the current pandemic and translating the visionary education at the Technion to a world of impact in Israel and around the world. Technion alumni are the university's pride. We have traveled all around the country to meet with alumni and bring them together to connect, network, share their inspiring stories. Now we moved all our activities online and are happy to continue bringing our community together while featuring alumni in our Cafe Shishi gatherings in Hebrew and our Zoom events in English. Today, as part of the ATS Live from the Technion webinar series, we are happy to showcase prominent Technion alumnus, Dr. Eyal Zimlichman, Chief Medical Innovation Officer at Sheba Tel-Shomer. Before I introduce him, I would like to share that following the presentation, we will have a Q&A session, and you are invited to use the Q&A feature at the bottom of your webinar screen to submit questions during this program. We will be asking as many of those questions as possible until we conclude the program at 1:55. My colleague Tova Kantrowitz, ATS Director of Strategic Partnerships and Outreach, will moderate this part. This presentation is also being recorded and a link will be sent to you within the next few days. Dr. Zimlichman founded the ARC Center at Sheba. ARC stands for Accelerates Innovation and Redesign Healthcare by Collaborating with Partners, presenting an open global innovation ecosystem that aims to redesign healthcare through digital health solutions by 2030. The COVID-19 crisis had been a game changer in accelerating these efforts. Eyal is a graduate of Harvard School of Public Health, Executive Healthcare Management, Master of Science, and has earned his MD at the Technion. He was featured in 2019 Israel's 100 Most Influential People this Jewish year by DMarker, the leading financial newspaper in Israel. Sheba Medical Center is on Newsweek's 10 best hospitals in the world for the second consecutive year and is the largest hospital in the Middle East. Israel Ministry of Health asked Sheba Medical Center to lead the fight against coronavirus in Israel. Eyal, while we missed the opportunity to host you in Boston in April, we are honored to have the opportunity to have you with us today. The mic is yours.
Hi, thank you, Anat. It's a pleasure being here with you. Of course, hoping for better days so we can meet in person as was planned in April. But of course, we take what we get. And it's my pleasure to be on this very prestigious webinar and tell you a bit of my story and a bit of what's going on right now at Sheba. Both what we've been up to in the past few years with ARC, as you mentioned, and also currently with COVID-19. So with that, I'll share my, my slides so we can start going through that. First of all, I think as Anat mentioned, obviously I'm a Technion alumni, and for me, going through medicine studies at the Technion was a great experience on all accounts. I never thought I'll end up in a managerial position. Always figuring that obviously you go to study medicine because you want to treat patients for the rest of your life, but things of course happen during the course of our careers. And we go through revolving doors, and we never know exactly where we're going to end up. So this has been my journey in the past 30 years or so. From Technion to being a doctor in the Army for about 10 years, going through internal medicine, residency here at Sheba, and then healthcare executive fellowship in Israel, and then in Boston for a few years, where I was doing research and also was holding a strategic role in Partners Healthcare, which is the healthcare system for the Harvard hospitals. Then coming back to Sheba in 2013 to take on the role of Chief Medical Officer, and about 3.5 years ago, Chief Innovation Officer on top of that. And the Technion played a role, in that regard, definitely in being able to look well beyond just medicine and healthcare, being able to understand that we have to work together with other industries. We have to think much wider than what we have in front of us. And this is something that I've taken towards the rest of my career. And I think you'll see some of that reflecting in ARC and the strategy that ARC is. Being at the Technion, obviously, very much exposed to whatever is going on, whether it's in engineering or mathematics or anything else that at the Technion we were going through in the first and second year, but also always exposed to other students and projects and research that was done. So that, I think, played a critical role in my career moving forward. And again, you'll see that reflect in ARC. Now, this is a very unusual situation that I'm holding these two hats at Sheba, both the Chief Medical Officer as well as the Chief Innovation Officer. You don't really find that too much around. There is one very big upside to having those two hats on one person, or even two upsides. One is we tend to innovate where our pain is. And as Chief Medical Officer, also in charge of quality and patient safety, I see the pain exactly as it is. And I wake up with the pain every morning, looking over my phone, just getting messages from whatever happened during the night in the hospital. And hospitals, some things that go on in hospitals are things we have to change. Patients get harmed. We're not providing the best care always that we would like to provide. We always need to improve quality and so on. And this is where we need innovation to step in. So having the two arms, one on the floors of Sheba, where the magic, if you might, of healthcare happens, and the other arm in the innovation allows us to really push innovation to where we really, really need it. So that is, I think, one big advantage. The second one is politically. As you know, in large organizations, and Sheba is a large organization, when you need to create change in the organization, we have to go through many hats inside the management, the C-suite, and so on. Holding these two roles helps me drive change. It's easier when I could at least know that I have the support of both the Chief Medical Officer and the Chief Innovation Officer for things I want to achieve. So definitely an advantage there. The disadvantage is, of course, I don't get to sleep as much as I'd like or see my family as much as I like, because these are two very busy roles in a large hospital as Sheba is. So, of course, upsides and downsides for everything in life, and it's a trade-off. I want to tell you a few words about Sheba. I'm sure a lot of you know about Sheba, but for those of you who are less familiar, Sheba is the largest hospital in Israel. It's also largest in the Middle East, as Anat was mentioning, and on top of that, it's one campus, as you see here in this aerial photo, which is not very common to see large hospitals be on one campus. We have 150 different buildings. We have 24,000 cars that come in every day, 10,000 employees, and 2,000 beds. Typically, that's how you measure size of hospital, is through the beds. We also have on campus 4 hotels and 2 shopping malls and a gas station and a lake or a reservoir. We like to call it a lake, as you see here. So definitely not your typical hospital. But apart from size, there's one other thing that Anat mentioned we're very proud about, and this is this achievement. We were just selected about 2 months ago by Newsweek to rank number 9 in the world out of 2,000 hospitals that Newsweek decided to rank for the world's best hospitals. It's the second year. Last year we came up number 10. We went up a spot this year. Moving ahead with this trajectory, we'll end up as number 1 in 10 years, maybe sooner, we'll see. But definitely a huge achievement. Not many things in Israel are ranked top 10 in the world, and this is something for the entire country of Israel to be proud about. And we're very proud of this achievement. And it's something that, of course, we hold very dear. So I've told you a bit about Sheba, and you heard about ARC, but I do want to devote a few minutes to explaining what ARC is. ARC is not an innovation center, as many people think. ARC is a strategy. ARC is an ecosystem. It's our, I would say, program that will allow us to get to where we need to be. What we've done with ARC is set a vision for the future, and specifically for the year 2030. This is the year we've decided we want to change the world by, and the clock is ticking, so every second counts. We have a vision of how healthcare needs to look like by that time, and we're looking for other partners that share the same vision, whether other academic health systems from around the world, or industry partners, and so on. And this is what we're aiming to achieve, a complete redesign of healthcare. I know it's a small accomplishment to try and do that. Some might call it even chutzpah, that an Israeli hospital thinks that they can change the world within that time. But to do that, we have 4 priorities or 4 principles that we're following in this strategy. The first is focusing on digital health, understanding that the main change vehicle to getting to where we need to be is digital health, probably much more than devices in pharma. And you'll see some examples later on. The second is open innovation, working together with others, with startup companies, with the industry, breaking down the silos, with other academic health systems, thinking not what's in it for us, but how can we help bring about this change? Only by working together will we be able to actually create such a huge change. And if you think that one hospital can do this, it's never going to happen, regardless of how many shopping malls you have and how many lakes. No one hospital can get there. You need to work together to achieve such a huge task. The third is international collaborations, and we're working with really the top-notch medical centers from around the world, many of them in North America, where we're most focused in the US and Canada, but many of the big names, and you'll see a few of them soon, from Mayo Clinic to Mount Sinai to Brigham and Women and Mass General in Boston to Thomas Jefferson and Henry Ford in Detroit and Cedars-Sinai and McGill in Montreal and Sunnybrook in Toronto and Zurich University Hospital in Switzerland and other hospitals as well. We work together as a community, as an ecosystem, a global ecosystem that share the same vision and are engaged to working and to making that a reality. And finally, it's about the innovation infrastructure to making that work. And infrastructure starts first with rules and regulations. And typically, as you know, large organizations, many of our rules and regulations and our bureaucracy actually hinder innovation. They actually slow us down. We don't move as quickly as we want to move. But being able to change that infrastructure of your policy to really fast-paced innovation is critical. Second is data infrastructure. Data is critical to moving forward. It's not just enough to have a lot of data. You need the right infrastructure for the data. And third, it's the physical infrastructure. And what you see here in this photo is a vision of how our ARC Innovation campus is going to look like by the year 2025. 5 buildings, a total of about 300,000 square feet of innovation space. 2 of these buildings are already up and running, and if you'll come, you'll see them. This is where we're operating from. But by 2025, this would be, we think, an epicenter of global innovation in healthcare. So this is what ARC is, and really to understand what we're focusing on as we talk about ARC, it's about these 6 hubs. This is our strategy, and where we're taking an opportunity to move forward in these 6 areas. Big data and artificial intelligence, virtual reality and augmented reality, the operating room of the future, telemedicine, which I'll talk more about, rehabilitation, and finally, personalized medicine. This is what's going to drive change. It took us a lot of time to get to these 6 areas. And for each one of those hubs, we have a leader that's pushing this hub forward. We have a budget, we have an annual plan, we have meetings, we have hackathons and other events to make sure we deliver on our promise to push medicine forward through these 6 hubs. And you'll see what happened to those during times of crisis in a few slides. And as I mentioned, that ARC is going to change healthcare in 10 years. It's not just about Sheba, but it's about all of these organizations together, from the startups that come in as ARC members, to the academia here in Israel, to international collaborations, and I mentioned some of these names, and innovation communities as well, and to corporate strategic partners. And you see the names here, small companies like Microsoft and Boston Scientific and Checkpoint and Janssen and Allscripts and MSD and AstraZeneca and Baxter. Together, this is what's going to change healthcare in the next 10 years. And we think we have a good chance of doing that. But then something happened, and COVID-19 hit us all. It was a big surprise. None of us really planned ahead for this. As you know, one of the first things at Sheba we had to ask ourselves, is innovation essential or non-essential in times of crisis? Obviously, doctors and nurses are very essential in times of crisis. But what about your innovation team? Should they go home for leave, or should they stay at the hospital and work for more innovation? It took us about 7 minutes to make a decision that innovation is not only essential, but is very essential and critical to winning the battle on coronavirus. And what we've done with ARC is declared battle mode, basically focusing 100% of ARC operations to tackle the challenges with COVID-19. And if you look at the top left corner of this slide, you'll see the ARC COVID-19 battle mode. And this is our new logo, at least while we're battling Corona right now, before we go back to routines with our other areas of focus. And the new game plan for COVID-19 is centering on all of these areas, from data to ventilation. You know there's a problem with ventilation solutions. We want to find ventilation solutions. You'll see some of that in a few seconds. To diagnostics, to telemedicine, to therapeutics, because we need to solve this problem also with drugs and so on, and mobile health with solutions for mobile health as well. So this is our new game plan, and I really don't have the whole time to go into what we're doing. There may be 80 different projects that are running now at ARC related to COVID-19. But I'll give you a taste of a few of them as we walk through this. Initially, when we started seeing the first patients, we've built a compound about a mile out from our main campus where we hospitalized the first coronavirus patients. In this compound, we wanted to minimize contact between the staff and patients so that we can prevent staff contracting the virus. We know that's an issue. We've seen it happen in China. We've seen it happen in Europe and the US. And we knew that's a major issue because as staff contracts the virus and the disease, they're not able to treat other patients. So what we did to minimize contact is we've used telemedicine technologies, even within a couple of meters away, to make sure the staff can take care of the patients in the same quality as if though the staff was inside with the patients. You see here some photos from our tele-tent, which was positioned about a few yards away from the patients, but of course not exposed to the actual virus. We used many different technologies, just to name a few. Early sense, a sensor you place under the mattress of the bed, continuously monitoring heart rate, respiration rate, and motion, and then an artificial intelligence-based algorithm that predicts clinical deterioration. We found this device to be very well positioned to alert us for deterioration of patients with COVID-19. As you know, the disease can be very mild with flu-like symptoms, and in a matter of hours, deteriorate to a life-threatening condition. We found that a device like EarlySense being able to continuously track respiration rate, most importantly, because we know the disease affects the lungs for and foremost, this is able to tell us ahead of time which patients are about to deteriorate so that we can transfer them to a higher level of care, like an intensive care unit, and make sure they get treatment in time to maybe prevent some of the complications that would happen. Another technology is TytoCare. Some of you might know about this, but this allows clinicians to actually perform physical examination on their patients without being in the same room. We typically have used this to examine patients at home where doctors were in the healthcare provider facility. But now, when we have patients in one room and the doctor a few meters away in another room, we're able to listen to the lungs, listen to the heart sounds, look into the ear, look down the throat, look for any skin lesions and so on. And what we've seen with many of our doctors is that they've got great responses in terms of how well they could diagnose the patient. You see here, Dr. Gadi Segal, the head of our the first corona unit, listening to the heart and lungs through the headphones and looking down a patient's throat through the camera, being able to diagnose a problem and change treatment and so on. And this is how we've done this. Many of our clinicians have gotten used to this new technology, and they're coming out saying, this is terrific. We'd like to continue doing this with patients at home so we could take care of patients at home after COVID-19 as well. And of course, that's a great opportunity to push telemedicine forward. Another technology is this InTouch Telepresence robot. Used in ICUs, this robot is able to provide what we call telepresence. The doctor controlling the robot can be at home while the robot is coming over to the patient bedside. Then they can converse, but also perform physical examination on the patient and so on. This, of course, again, very useful when you try to minimize contact between staff and coronavirus patients. What we've also done is come to an understanding that we need to treat the mild cases at home. There's no need to bring mild COVID-19 cases to the hospital. And so to do that, we've come up with this zero-touch telemedicine toolkit or hospital at home toolkit that has an ability to monitor patients like EarlySense, for example, or BioBeat, which is another example, perform physical examination with technology like TytoCare, and provide full management through the platform called Datos, which we're using for our patients. All of that put together in a box. As you see, sorry, we don't have that slide, but put together in a box, allowing us to take this to the patient at the home, and the patient would do his hospitalization at home with us taking care of him through the technology. Once the hospitalization at home is over, we collect the devices back, sterilize them, and use it on the next patient. This kit has gotten great reactions around the world, and people are copying this model in many different locations. We've seen it happen in the US, in South America, in Europe and other places, and we're very proud that this has really got a lot of traction and helping many patients around the world. We talked about ventilation solutions. You see here in these photos a couple of ideas what we've been busy with in the past few weeks. This is myself checking one of those devices, automatic AMBU, able to automatically pump air into the patient when you don't have a ventilation machine. You know, the main concern was we run out of ventilation machines. Happily, that didn't happen in Israel. It did happen in some other parts of the world. Converting a non-invasive ventilator like a BiPAP to an invasive ventilator, which was a design we've done together with the Israeli army, with one of the secret units in the intelligence corps. A device that created, again, a lot of attention around the world, and we get a lot of requests of many countries and hospitals looking to get a hold of such a technology to help them in times of crisis. And collaborations with the Army, with Mafat, which is the R&D section of the Ministry of Defense, the Israeli aerospace industry, and so on. I could tell you, before COVID-19, we never thought we'll be collaborating with the defense industry. You know, you saw our partners, definitely different companies, but the ARC model works very well. The collaboration works very well in times of crisis, even with defense industry. We're upfront. Maybe we don't have too much in common, but when we start working together, we can get a lot of things done very, very quickly. And that was the case here. Tele-ICU with many solutions, from artificial intelligence solutions like Clue Medical, providing us insights into patients' conditions, to the telepresence robots, and other applications as well that we don't have time to go into. But this ICU you see in these photos is an 80-bed ICU facility we've built inside an underground parking lot underneath our women's hospital at Sheba. It took us 72 hours to build a state-of-the-art ICU with 80 beds. Fortunately enough, we never had to use all 80 beds. I think the full capacity was about 40 at the peak of this, but now we have about 30 patients ventilated still inside this facility, treated with all this technology we've been working on. Tele-teaching, we've been very fortunate. Microsoft, as I mentioned, was one of our is one of our strategic partners, and they provided us with the most advanced virtual reality and augmented reality HoloLens. It's the HoloLens 2. We've been the first in the world to use it. It just came out of the factory. It's a new design, and we've used it for remote teaching, remote guidance, remote presence, for many, many different applications to teach our staff, to be able to provide them with guidance when they treat the COVID-19 patients. It was a great experience for us as well. Thermal and contact screening, working with a lot of the defense industry, like Rafael, for example. I know you'll be hearing from them in one of your next webinars, and others like AnyVision and other companies, to come up with solutions to measure temperature very accurately. You see this in the left photo here, and on the right side, an ability to use an artificial intelligence to track contacts between staff. If we diagnose one staff member positive with the virus, we know that people he was in contact with might need to go into isolation. So we use an AI to actually identify who was in contact with that index patient, for how many minutes and how close, and the AI actually provides you all this information, so you could do these quick queries and isolate people that need to go into isolation, so that we don't infect other people, obviously, in the hospital. So a lot of advancement, again, in a few weeks, very short while. We've done so much in this space that wasn't there before. Huge work around data. I won't have time to go too much into this, but really looking into building, and this is something that's an ongoing process, building a COVID-19 registry, the largest in Israel, one of the largest in the world, very deep in terms of the level of data that we have. We're doing this with our data partners, MD Clone, and what we've done is we've opened access to everybody that wanted across the country, and outside of Israel as well, to get access to this data in the cloud. I could tell you, we just came out of a webinar a few hours ago with some of these groups. The amount of insights that's coming out about this disease is amazing. And we knew that there's so much talent around data that exists in Israel and around, that all we need to do is provide them access. And this is what we've done. Just provide access, of course, through all the regulations needed to these wonderful groups, some of them coming from the Israel aerospace industry, or again, R&D, in the R&D defense sectors, but providing so much insights on the disease. And this has been a joint effort between Sheba, MD Clone, and many of these industries here in Israel. So we're very excited about that. And I think there'll be so much to tell about this initiative. We're just starting to understand. So really towards the end of my presentation, when you look at the ARC strategy, it's a perfect fit for times of crisis. When we talk about accelerate, redesign, and collaborate, we talk about acceleration, and we see this huge acceleration opportunity right now during COVID-19. It's quite amazing the pace at which we do stuff right now, which could have taken us much longer in usual times. And of course, we're taking advantage of that to push forward with more and more innovation. Second, to redesign, to think completely differently, to use technologies intended for one thing, but then use them for another thing, like this Title Care, like Early Sense, using them with COVID-19 to provide the zero-touch capabilities and treating patients, again, with minimizing exposure to the staff, while providing excellent healthcare value. And finally, collaboration. You've seen the ARC ecosystem on day-to-day life. With COVID-19, it's looking a bit different, but it's a lot of collaborations. And with industries, we have never thought we would work so closely together. And actually, this is bringing about a lot of talks between us and some of the defense industries to continue this collaboration even after COVID-19. The Israeli aerospace industry with Rafael and some others, we could definitely benefit healthcare and benefit patients much more with some of those huge resources going towards defense on day-to-day being diverted towards healthcare. And if we've done so much in the past a month and a half working with them, imagine what we could do in a year or 2 years or 5 years. And I think that's one of the huge things we're learning from this incidents. And finally, my last slide, you've seen the ARC hubs and how we're working in day-to-day. We've transitioned to this battle mode COVID-19, putting our full emphasis and full focus on solutions for COVID-19. Now, what's going to happen? We're in discussions currently about coming out. What is the exit strategy? Everybody's talking about that. And what is the exit strategy for ARC as we come out of this event? And I could tell you that what we're going to do is basically this. Corona or COVID-19 or however you want to call it is becoming a new hub within ARC. We call it ARC Corona, and it's going to be just like our focus on the operating room of the future or telemedicine or rehabilitation. We're going to continue to focus on this as we move away from this event. And it might not be Corona that's next we're going to tackle. It might be another pandemic, but I can assure you we'll be much more prepared for the next time. So I think I'll stop here, and of course I'll be happy to answer any questions. Thank you very much.
Thank you so much, Eyal, Dr. Zimlichman, for a great talk and update from Israel. It was fascinating to hear about ARC, innovation strategy, and philosophy, about the technologies and solutions you use, and about making magic at Sheba and in Israel, while pushing innovation in healthcare as being a part of a global ecosystem. We will move to the next part with the Q&A session, and I would like to remind participants that you can use the Q&A feature at the bottom of your screen to submit questions. I'm turning the mic to my colleague, Tova Kantorowicz, Senior Director of Strategic Partnerships and Outreach, who will moderate this session with Eyal. Tova?
Thank you, Anat, and hi, everybody. Thank you, Eyal, for an amazing presentation. Very, very interesting, and makes us all hopeful for the future in the care of patients in this new world. I guess you started talking about how Sheba was recognized 2 years in a row as being one of the top 10 hospitals in the year in the world. And I wonder, what is it about Israel in terms of this recognition, but also in terms of these innovative collaborations with the IDF, et cetera, that makes it so special in terms of dealing with this particular crisis. And of course, we look at the data overall from the state of Israel and how it's fared pretty well as compared to many other places in the world. So just curious to hear about the Israel advantage.
Well, I think that's a huge question. And of course, one that we're thinking a lot about. And books have been written about this, as you know, and I think if you ask me, I think Israel is there to dream about the impossible. We basically feel that nothing is impossible. I had a mentor in the U.S. at one time that I asked him, why do you always have an Israeli fellow with your program? And he said, because whenever something everybody else tells me is impossible, I always turn to my Israeli fellow to do it. And I think that's the really the heart of everything that was done here. We're not intimidated to dream. We're not intimidated to think big. We start by saying, what do we want to accomplish? And if we want to accomplish a much better world by 2030, a much better healthcare by 2030, then that's what we're going to do. We're going to change how healthcare is being done, so it's much better and much more focused towards the patient and bringing us much better outcomes. I've never seen hospitals that actually are thinking that this would be their aim, and stating that, I could have said, this is my life mission, to do that by the year 2030, and we actually aim to do this. And then we look for ways to do it. And if we need collaborations, and of course collaborations are critical, we look for the best partners in the world to work with, the best hospitals, the best industry partners. And with COVID-19, it's been much of the same. Who would be our best partners here in Israel? to get to where we need to be. And there's nothing that's impossible. That's at the core of everything we've seen. At one point, I was reached out by the New York Department of Health. I have my friends there, and they said, listen, we've encountered a problem. We don't have a solution. What are you guys thinking? And within about 6 hours, I got together a huge group from Israel, from the IDF, from other defense industries, and Sheba and ARC, to come together on this webinar and try to solve this problem together with the New York Department of Health. So for us, no task is impossible, and we would solve everything we need to solve.
Is there something about the culture of Israel? When we spoke a few weeks back, I think you had mentioned this collaborative sort of culture, and you know, it's a small country, people kind of know each other. How did that come into play?
Yeah, I mean, this collaboration is critical in Israel, and it's much better when it's across industries. We probably collaborate better with the Army than we collaborate with other academic medical centers in Israel. Sometimes it's unfortunate that we can't collaborate better with others, but with other academic medical centers. But for us, it's very natural to go across industries. I could tell you that about 2 months ago, I got a call on Saturday, and it was somebody from the Mossad in Israel who said, listen, we're coming in to help with COVID-19. Can you spare us a room in your innovation center at Sheba? We have 4 people who need a place to sit. And I said, of course, what do you mean? You know, it's yours. And the next day when I came in, there were 150 people there from the Mossad. So this is Israeli spirit, Israeli chutzpah. We didn't get too mad at them. We solved it out. We found everybody a place to sit, and we started working together. That's been the nature of the collaboration for the past 2 months.
So now turning a little bit to telemedicine, which was the focus of a lot of your presentation. And in fact, it was interesting to see in your teletent, one of our graduates, Dr. Yehuda Sabiner, who was a guest on one of our recent webinars as well. I'm just wondering, and some people have been asking, how does this remote medicine, telemedicine, compare to, in terms of results and outcomes for patient, to traditional medical care that's in person?
We're starting to figure that out, and actually we're surprised with the huge benefits we see. The world is about to change completely with telemedicine. If I had to say what would be one thing that would have the biggest impact on how healthcare would look like in the year 2030, it would be telemedicine. And specifically within telemedicine, it would be hospital at home. And what is basically hospital at home? Hospital at home is for people who need acute hospitalizations. If you could think of somebody with pneumonia or urinary tract infections or any other problems that bring us to the hospital because of an acute condition. Now think that you could do your hospitalization in your own home. I could remind you, you cannot get hospital-acquired infections in your own home. There's nobody to contract it from. So what we're seeing is with this type of healthcare delivery models, we're seeing better outcomes. We're seeing less complications. We actually see people fall less at home than in the hospital. We're seeing higher patient satisfaction. And so what we're learning is that we need to completely rethink how we're doing healthcare. We need to understand that the world today much rather skip the traffic jams and looking for the parking. And as people know in Sheba, that's not our best side, the parking's issue. And you could stay at home and get a text message at a certain time that says, your doctor will be ready to see you in 5 minutes, please go on the platform, like we're using Zoom right now. And you'll have the #1 professor in a certain field be in your living room talking with you for 15, 20, 30 minutes about a problem you might have. This is where the world is going. We understand that this carries so many advantages. And it's not just something that telemedicine that we revert to because there's no other choice. But telemedicine would become the first choice, better than physical care at the facility.
And a practical question that some people are asking is, not only in terms of the effectiveness of telemedicine, but how do you deliver the treatment? It's one thing to have these diagnoses and have the devices to diagnose and transmit to a central location to diagnose, but what about delivering the treatment?
So for now, for example, in the hospital at home program, when a patient, for example, needs to receive an IV liquids or IV antibiotics or whatever, there is a nurse that comes over to the home and connects the patient. And of course, that is done still through those means. The doctor, however, performs a physical examination from his office using technology like we've seen here in the slides. And that's becoming more and more common. There are even companies now working to allow doctors to examine the abdomen from afar, because that's been a problem. How can you examine an abdomen from afar? There are technologies today that will allow us to do, or we're starting to develop technologies that will allow us to do pregnancy testing, ultrasound for pregnancy at home with the actual woman who's pregnant, running the ultrasound and the doctor seeing the results from far away and providing the outcomes. So the world is rapidly changing. The technology is no longer a barrier. We have great solutions for much of that. And with time, we'll have better and better solutions.
It's wonderful to see how the innovations that ARC is putting forth in Sheba and how you're sharing it with other institutions. Here in the US, we haven't had the same experiences in Israel. We're still really fighting it, especially here in New York, even though you see Haifa in my background. I'm actually sitting in New York. How can the US and the medical industry in Israel, in the US, learn from your successes? And how is that being assimilated into the medical care here and the treatment of the disease?
So I think, of course, we don't know in Israel how to better treat COVID-19. We don't have insights into the nature of the disease. It still puzzles all of us in terms of, what would be the right drug or the right management protocols. We're learning together with the world. There's a huge community, and it's wonderful to see how the medical community is working right now in sharing knowledge. And we're part of the medical community around the world. But we do have other advantages that I think have helped us get these results that we have. One thing is, of course, how quickly we reacted. I think, when you look at reactions of different countries to COVID-19, it's a matter of a week or a few days that you postpone your reaction to be the difference between a huge catastrophe to a success. It's not about waiting a month with closures and lockdowns and so on. It could be a difference of 2 or 3 days that you delay. And I think we were lucky enough to be on the better side of that. We went into lockdown, as people here know, well before other countries. When we closed the skies, we were under a lot of criticism by many countries that said, what are you guys doing? This is going to hurt our relations. But still, the decision was to do that. The Ministry of Health in Israel was pushing towards more and more restrictions. And I think that proved itself to be the right approach. And not only in Israel, we're seeing this in other countries that have done so. And a delay in a week or 2 weeks could be really the other side of this. So this is one end. It's not related to Sheba, of course. I think it's the national response here in Israel. The other end, I think, is how hospitals here can quickly react to times of emergency. We're used in Israel, unfortunately, to react to times of emergency. We don't typically have to do with pandemics, but you all know the problems we face here. And our ability to go within a minute from normal life to times of crisis is something that helped us very much here to achieve the results we've achieved so far, hoping those results hold. Our ability to build an 80-bed ICU in a matter of 72 hours. Just to tell you, the full capacity of ICU beds at Sheba is about 80 beds. So we doubled our ICU capacity within 72 hours. Our ability to build a compound a mile outside of Sheba, built with the most sophisticated technology to allow us to better treat our patients. Our ability to go very quickly from times of peace to times of war, I think really helped us in how we respond here. And we're seeing that a bit differently in other hospitals around the world.
Switching gears a little bit about particular technologies, especially some of the ones that we have been talking about here from the American Technion study and the Technion in Israel. One in particular, one of our participants asked about is Pluristem, that has been used to help treat the lungs. Can Can you comment a little bit about that and any other promising technologies that you feel are, in terms of even the vaccine for the future? What is your opinion on all these new reports that we're getting every day?
So, you know, of course, we could talk a lot about many solutions out there in that regard. But when it comes to therapeutics, I think we need to think about this in a couple of ways. One, of course, is vaccine and their ongoing efforts for vaccine. And vaccine will be, you know, the ultimate answer once we get that out. You know, there are many approaches to this. I don't want to sort of go in between the different options for vaccines, but it's likely that we will get the vaccine out. And I think a good time span would be around a year from now that we're likely to see these vaccines starting to emerge and being used. People need to remember one other thing. Even if we do have the vaccine ready and approved for use, it's going to take a long while for everybody to get the vaccine. We'll start seeing factories around the world starting, you know, creating the vaccines, but for all the billions of people, it will take us another few months to get to everyone. So let's keep that in mind, that even once we do have the vaccine out, it will take us maybe up to 6 months to get everybody vaccinated. So that's the vaccine. But obviously the other side is you know, our drugs or medications. And for that, we're seeing two classes that we're focusing on. One is utilizing existing solutions. And this is what we've been mostly seeing in the past few weeks. You've heard about chloroquine, you've heard about remdesivir and other drugs that have been around before. These are not new drugs. They've been used for other purposes, and we're thinking about repurposing them to COVID-19. I could say one thing about those solutions, that they will never be the ultimate solution. The best ones will be able to improve survival by 10%, 15%, 20%, because remember, they were made for other indications, and we're using them for different indications. And then the other way to look at this is trying to find a medication that would be specifically directed towards COVID-19. And this is where it's going to take a while because coming up with a new drug for COVID-19 is a very, very long process. So that's likely to come after we have a vaccine out, which means that this is not something we need to look out for. And lastly, I do want to talk about one other thing, which is cell therapy approach. You mentioned Pluristem. And I do want to mention something we're doing here at Sheba I didn't have time to relate to. We've been having a lot of experience at Sheba. We're the first in the country to use what we call CAR T cells, which basically are T cells, lymphocytes, that have a major role in the immune response, that we remove out from the body, we reprogram them, and we introduce them back to the patient. We do that for cancer, but can we do this also for COVID-19, for the SARS-CoV-2 virus? And this is what we're focusing on at Sheba, and we're having very nice initial results. And this might be something to look out for, cell therapy for COVID-19 cases. So something, and this is the same idea with Pluristem in a somewhat different approach, but cell therapy is another thing to look at.
Great. So we have reports that this week Israel opened up. I saw pictures of Machane Yehuda, which is the, you know, quintessential place that you figure would open last, open today. Everybody wants to shop there for Shabbat.
Right.
Do you think that Israel now is in danger of another spike from the disease? Also in the United States, many states are opening up. Not here in New York yet, but I think that's a very big concern of our governor right now. How do we know when it's the right time to open up?
It's a great question. We don't know the answer to that. We could speculate, we could, have theories or leading theories and so on. The right approach with this, obviously we can't stay in a lockdown, so we have to start opening up. The right approach is to do this very slowly. It typically takes about 2 weeks from the time when you change something in your policy to when you're going to start seeing an effect on the numbers. So what you probably want to do is relax some way, then wait 2 weeks, see that it doesn't have a negative effect, and then relax some more. And this has been sort of the approach here in Israel. I can't say that we've been doing this completely with these 2 weeks plan, but this is the right approach to do it. What we're seeing with other countries in Europe, like Austria, like Denmark, that have started doing this about 3 weeks ago is we're not seeing a second wave. And of course, that's very reassuring and optimistic for us to think that maybe we're okay. Maybe there won't be a second wave here. I do want to remind us all, it's okay to relax, but we need to remember 3 things that we have to continue doing. One is the masks are critical. People underestimate how much the masks help. The masks are critical. You could continue about your business with a mask on, and your chances of, your risk of contracting the virus is very minimal, even if you go to a restaurant, or even if you go aboard a plane, or even if you go to a movie theater. If you have a mask on, your chances are much, much lower. Second is the distancing. We're talking about 2 meters or 6 feet between people. Again, that's something else to watch for. Even if you have the mask on, keep that distance. And third is the hand hygiene, which is critical because we know the virus can be transmitted through surfaces. So if we do these 3 things, we can relax, we can open up commerce, we can open up the shopping malls. Shopping malls are opening now in Israel as well. We can go on planes very soon. So I think that's what we need to do. We need to open up, because otherwise this is not sustainable from the economy perspective, but we need to remember those 3 things.
I have a few people who have written in, our Technion fans, about the telemedicine platform, Datos, that was the head of that company as a Technion graduate. Just wondering if there are other technologies or people, and we mentioned before Yehuda Sabiner, who have Technion DNA, perhaps if you know of any others who are involved.
Well, I don't know for sure. I think I know, but I don't want to say the names because I'm not sure. But definitely I could tell you that I won't be surprised that the vast majority of the technology we're using is coming from Technion alums, like Datos, which has been selected as our main telemedicine platform. And it went head to head with leading technologies from around the world. We consider them a very close partner in our voyage forward towards, again, redesigning healthcare, and other solutions out there as well. So I wouldn't be surprised that many of them are coming from the Technion.
Great. And I know we're getting close to the end of our time with you, because I know you have to jump onto another meeting, but somebody was asking, and I think more than one person, about testing. And I think that's a big thing that's happening here. Is it worthwhile to do widespread testing for antibodies at this time to see if we can mitigate the disease?
Well, getting to that point, the problem with the antibodies is that we don't have a test that's accurate enough, or that we know that it's accurate enough. We need to run clinical trials to make sure how accurate they are. We still don't know another thing, which is how the antibodies react to the virus. So we don't have the full picture yet, but we're very close to being confident about it. I think in a week or 2, we'll start seeing antibodies being used around the world. So it's very short while before we get there. And then what I think we need to be doing, and it is something that is planned for in Israel, is we need to be able to run these screening surveys around the different countries to understand exactly where we are, and not be in the blind and wait every 2 weeks to see, again, those reactions we're seeing. If we do have a program that screens the public, a mass screening of you don't have to do more than a few thousands every week or every month to get a good understanding of how the population is reacting to changes you're making. So once we have that tool, it will be another tool in our arsenal to have a better feel of how things are going and be able to better face the next weeks and months.
Well, I thank you very much. I know you have to hop on to another call, and so we really appreciate you taking time out of your busy schedule for us. I just want to let everybody know we are sorry we couldn't get to all the questions today. We will compile them and try to get the answer from Eyal at a future date and send them back over to you. So don't worry. I know a lot of people are asking for your contact information, if that's possible, and also questions about collaborating with other medical institutions and companies. So we'll forward those all along to you to respond to. And Anat, I think you might have some final words or.
So just want to thank you all very much, and it's been really a pleasure being with you, and I wish everybody good health, and may we all meet again in better days very soon.
Thank you, Tova, for moderating this session, and thank you so much, Dr. Zimlichman, for dedicating the time for us today and bringing to us the Israeli spirit. Thank you for the inspiration, for your leading role, and for the important work, and for highlighting the Technion's impact on your career, philosophy, and leadership, while innovating for better, safer, and healthier future. If the coronavirus has underscored one message, it's that the world is one big global village, as pandemics affect us all, and that collaborations and Israel's leading innovation and efforts in developing solutions for the global healthcare marketplace is helping to tackle worldwide challenges. As a reminder, this presentation has been recorded and a link will be sent to you in the next few days. We look forward to having you join us again next week on Wednesday, May 13 at 12 p.m. Eastern Time, 9 a.m. Pacific Time, when we will join by Technion professors, Moran Berkovici, who is working on developing a rapid diagnostic test for COVID-19, and Jose Snitman, who is working on developing new technologies for delivering drugs to the lungs to treat acute respiratory distress syndrome, the principal cause of death among coronavirus patients. You will receive an invitation to these and upcoming speakers in our Live from the Technion webinar series. Thank you all for joining us today. Stay safe, stay healthy, and thank you for your support of the Technion. Thanks.